We know that patients should be near a medical center for the first few weeks after the therapy. Do you have any organizational tips for how a care partner can best prepare for the return home?
Absolutely. So yes, it is required. So the patient generally stays in the hospital for 2 weeks, and then it's required for them to be very close to the hospital for 2 weeks after that, because it requires many visits. I think preparing for home is also knowing that they have adequate and support for transportation, because sometimes the patient may have to come in 2 to 3 times a week for support, usually in the bigger institutions. Also, reconnecting back with their local oncologist just to make sure that if something does happen and they can't get to the cancer center quick enough, they have another support. And to also be able to monitor them, make sure they have thermometers and blood pressure machines and things that are going to be there for them when they get home.
Do you have any tips for making the physical space at home more comfortable?
I always say that's individualized and everybody's home is different. So it's hard to say that. I'm very minimalistic. So I always say don't have a lot of clutter, because post CAR T, you may feel a little weak or tired. So make sure that, they're not navigating around a lot of furniture. There's not loose rugs, equipment like that. They may need some support even in the showers, that they may need a shower chair, depending on the patient's physicality. But that's a very good discussion to have before they leave the hospital. Maybe our social worker teams can set up VNS and be able to put some support into the home.
Are there any supplies that care partners will need as they care for a patient at home?
Supplies are very simple. I'll be honest with you. It's generally thermometers and maybe an automated blood pressure machine, I think, and then a pad of paper and pens at work itself. And also, like I say, it's having the transportation or having a backup of something if the patient doesn't feel well to get there. But in supplies, no, the patient should eat what they normally eat. I would say not as spicy because they may not be able to tolerate it, but things like that.
Hmm. And a calendar, I would think, would be pretty important.
I love calendars. I'm a calendar writer, so I like it usually on paper, but people like it on their phone. So I always tell patients also to keep a diary of how they feel, because they come to us, and I think it's very common where you go, I had a million questions to ask you, and then they forget. So it's always good to say, oh, he had a little, he might have had some loose stools or diarrhea on this day, but then they forgot to tell you. So I think it's good to document those things,
Yeah.
and even
For care,
weight,
pardon me?
and even their weight. So all their vital signs and weight should always be documented.
Okay, thank you. Who is the best point of contact at a medical center if they need support?
It's actually the medical team. The best support is the medical team, depending on it. And each institution, I'll say, may have different ways of accessing it. We have a 24-hour hotline. So when the patient doesn't feel well, they can call directly in. If it's simple questions, they can always use the EMR messaging services that we have at our institution. So each institution may have a way of doing it, but I would say always reach out to the primary team.